Welcome. This is my sixth video of the COVID-19 series, and here I look at an article from colleagues at the University of California, Irvine, speaking about the harm of media exposure. This paper is published in the official scientific journal of the Society for Health Psychology, which is a division of the American Psychological Association. Its mission is to advance the science and practice of evidence-based health psychology and behavioral medicine. Here, I am driven to amplify portions of the article I've highlighted in green or given my own emphasis in red. The yellow highlights are other sections I found notable, but in the interest of time, I will speak only to the green sections. At the end of the video, you'll find bullet points of salient takeaways. Feel free to pause the video to study this document in greater detail. In order to comment on the risk of media exposure during the COVID-19 outbreak, the authors cite studies on consequences from media exposure to the Ebola outbreak, the H1N1 outbreak, the 9/11 attacks, and the Boston Marathon bombing. They remind us here that ambiguity in communication leads people to overwhelming perceptions of threat. That means the strategic way to communicate during crisis is clear, simple messaging. Here, they cite that even 2 to 3 years after the 9/11 attacks, both psychological trauma and physical health complaints were worse for those people who saw more attack footage on TV. And then later, here they conclude that even if we live far away from the story of harm being told, our vicarious trauma can hurt our physical health. Finally, I found this discussion point brings helpful context to those at risk. People who seek out more media are ones with overwhelming concerns, and having those concerns are not any one individual's fault. So when it comes to people who we believe are watching too much TV or constantly reading stories online, it is unscientific to blame them for their behavior. Remember that it may be the very people who have overwhelming perceptions of threat that are struggling to adapt by scouring information or seeking tactics to stay safe. As a society, we must compassionately communicate to people who are at risk for media exposure harm. To close, I appreciate my colleagues for presenting their concepts and findings in such a timely paper. I look forward to reading more work of this nature. That's it for now. I want to end by wishing you and your teams the best of health.